What does a fetal medicine specialist do? A fetal medicine specialist essentially looks after babies before they are born. It is when the baby is in your tummy, when you're pregnant, and a fetal medicine specialist looks at a whole range of screening that we can do in pregnancy, diagnosis that we can do of the fetus in pregnancy, as well as certain therapeutic or treatment that we can institute for your baby while the baby is still inside. So essentially a fetal medicine specialist is your baby's advocate who looks after your baby in pregnancy. How can a fetal medicine doctor help you? So when you are pregnant, when you get pregnant and the joy of having a new baby, majority of management is done by a general obstetrician and gynecologist. There are, however, certain conditions that require subspecialty care or specialized care. And these include if there was any chromosomal or genetic problems with the baby, if there was any developmental abnormalities or problems that we detect during your pregnancy, if there was any placental issues, meaning the placenta is not functioning as well as it should, if the fluid level is different, if there were problems with the umbilical cord, and of course if you yourself had a particular medical disorder that may have an impact on the health of the baby. In these certain circumstances, it is important that you have a fetal medicine input to ensure smooth running and delivery of your baby. So what are the most common fetal abnormalities? The commonest abnormality that we see actually is around the fetal heart. And thankfully, the commonest abnormality is usually not a significant or a severe abnormality. And these are holes in the heart that we can see on ultrasound. As I said, majority of these are normal, they close by themselves and do not have any impact at all on the baby. Now, in terms of abnormalities, you could find abnormalities in every single part of the baby's body. So this is why the 20-week scan is important. It's important that we have a look right from the head of the baby to the feet of the baby to look at all structures and all systems to ensure normality within all of it. Is an ultrasound safe for your baby? And the answer is absolutely. Ultrasounds are sound waves that we use transmitted through your tummy to reach the baby and have not had proven to be of any harm at all to your baby. So the answer is yes, and you can have frequent ultrasounds if required in your pregnancy. How many scans do you have in your pregnancy? Now, typically you have anywhere between 3 to 4 scans in your pregnancy. As you find out you're pregnant, you will have a scan in the first trimester, and that's what we call a dating scan. And that's just to make sure that the pregnancy is in the right place and the baby's doing well in the uterus. Then you have your second scan, which is at the end of your first trimester. This is called the nuchal translucency scan, which looks at essentially screening for chromosomal or genetic abnormalities such as Down syndrome, but it also does other things such as look at the structure of the baby and determine the dates of your pregnancy. The milestone scan at your second trimester is the anomaly scan. That's typically done between 20 to 24 weeks or so. And that looks at the whole structure and the development of the baby to ensure normality in growth and development. And the final scan you do is in your last trimester, in your third trimester of pregnancy, typically between 28 and 34 weeks. And that looks at the placental function and the growth, the fluid around the baby, and what we sometimes call the Doppler scan as well. So this is the Doppler that goes through the umbilical cord, looking at how well the placenta is functioning.